All right, we're back with our next segment of the IRG Physical and Hand Therapies Health Talk. Dr. Christopher Thomas joining us. He's an orthopedic surgeon at Skagit Regional Health in Mount Vernon and Arlington. He's talking about something I've never heard about. Jones soda, yes, but Jones fracture, no. What is a Jones fracture, Shannon?
Yeah, John, that's good. That's a good analogy. No, it's not Jones soda. It's a Jones fracture. This is a fracture of the fifth metatarsal in your foot. This is the fracture that Derrick Henry, running back, I believe, for Tennessee Titans, experienced, I don't know, maybe 8 weeks ago or something like that, plus or minus. But word on the street is he is going to return from that Jones fracture. So we're going to talk about the Jones fracture. What is it? How do you treat it? How do you recover from it?
All right. I'm very anxious to hear about this. Here is Dr. Christopher Thomas and Shannon O'Kelly.
Dr. Thomas, welcome to Health Talk. How are you?
I'm doing great. Thanks for having me today.
Thanks for joining us. I'm excited to talk to you off air. We were talking talking about your background. I mean, you're a football player from Eastern Washington and went on to become an orthopedic surgeon. That's pretty cool. What led you down this path of orthopedic surgery? Was it an injury? Was it an experience? Just tell our listeners kind of how you got started.
Well, I always knew I wanted to be a physician since I was little, but once I really got into college playing football, I got to experience a lot of injuries firsthand. Got to see a lot of pretty impressive injuries as well, and I had a lot of work in the physical therapy office, a lot of time with orthopedic surgeons. So since I knew I was going into the medical field, it kind of just felt second nature to go into this field where I just get to deal with musculoskeletal trauma, I get to see problems, I get to have solutions, and I get to get people better and back out to doing what they love.
And you currently are working in orthopedic surgery at Skagit Valley Hospital. You work out of a Mount Vernon location and also in Arlington. So you're taking care of all different kind of orthopedic problems. Do you have a specific interest in your practice?
I would say my practice has developed a lot into treating some arthritic conditions as, say, some of your joints wear out, like your knees and hips. But I also have a very large sports practice as well. So I'm dealing with a lot of mountain bikers. They're pretty active up in the area. The snow season's coming up, so I expect to see a lot of skiing injuries, a lot of snowboarding injuries. So it's rolling pretty well.
It sounds like a great practice. Hey, real quick, you said middle-aged athletes. I'm kind of upper middle-aged. You'll still take care of me, won't you?
Of course,
yeah,
of
right.
course.
Yeah, okay, let's talk a little bit about football injury. This last season, NFL season, a very prominent NFL running back, Derrick Henry, sustained a Jones fracture, and it's season ending for him. And so let's talk about a Jones fracture. Let's set it up. What is it? We'll talk about the mechanism of injury, kind of rehab, recovery, surgical intervention. But what is it? Anatomical, what is it?
So a Jones fracture is a fracture in your foot. It's a fracture of the metatarsal bone, particularly the fifth metatarsal. Now, the metatarsal bones are the long bones in your feet. And if you went down and felt your foot right now on the outside edge, you can probably feel that little bony prominence. It's the bone that's right above where your toes are, and it actually plays a pretty crucial role. It is part of the columns that support your feet. There's a medial column, middle, and lateral, and it's part of the lateral column. What makes this bone and fracture unique, and a Jones fracture in particular, is because where the injury occurs, it occurs between the articulation between your fourth and fifth metatarsal. And at that area, there's actually a very poor blood supply based off how anatomy works. So when a fracture happens there, sometimes there is a high incidence or high percentage of patients who will develop a non-union, and that's when the actual bone doesn't heal, which can also lead to a delay in your actual recovery and your eventual return to your sports and activities.
Yeah, I want to talk about this. I want our listeners to really appreciate anatomy, physiology here. So what you're describing is this fifth metatarsal, which is a very important aspect of your foot when you plant, roll over, push off. When you talk about gait mechanics, you can't do without good feet, right? And when you talk about mid-shaft or shaft fractures, the bone needs a solid blood supply to lay down calcium and all the proliferation of these cells that are going in and kind of refabricating that fracture. If you lack blood supply, you're talking about a non-union. Tell us, is this why you are going to fix this? How are you going to fix it?
This is definitely why I'm going to fix it in my practice, and why most people are going to fix it in their practice, especially in someone who is of a high demand or high caliber athlete. Even if you're looking at college or professional athletes, moving forward with surgery as soon as possible is going to give them the quickest, most reliable route to heal this and get him back onto the field as quickly as possible.
We'll be back to talk about those Jones fractures as we are chatting with Dr. Christopher Thomas from Skagit Regional Health in Mount Vernon and Arlington. He and Shannon continue that conversation right after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
We're continuing our conversation with Dr. Christopher Thomas and Shannon O'Kelly.
Dr. Thomas, again, thanks for joining us on Health Talk. You did a great job describing this Jones fracture, this fracture of the fifth metatarsal. So let's talk about fixation, why you would fix it to promote that healing, and how that works.
So when bones are healing, they can heal in one of two ways, by primary or secondary intention. Secondary intention would be just your body forming a callus, and that callus hardens. It supports the two bone pieces that are broken, and then allows your body to remodel and fix that over time. Primary healing is where we actually use some type of mechanical stabilization, and you put those two fragments together end to end, and you try to compress them, and it allows the bone to directly heal to itself. So when you do fixation of this fracture, you're going to be looking at using what would be called an intramedullary screw. Now, that's a screw that primarily is all the way inside the bone. When you place this screw, its function is to go across that fracture site, and as you tighten it, it compresses that fracture, and bone loves compression for healing. So as you tighten it, it compresses that fracture, and then it heals. It also gives it just the stability it needs to help decrease those odds of non-union. And when you treat a Jones fracture with this type of treatment, you actually get healing rates up to 96 to 100%.
So what you're doing, you just come in, this is great. I love the carpentry aspect of it, really is. So, you really are. Yeah. So you got this fractured bone, a small bone, by the way, people. This is not a huge bone. You're putting this screw in there. When you put the screw in, it draws the two fractured pieces together, compresses them, puts them back together, and the body is going to promote healing. So that callus formation is going to come on a little better, maybe a little faster.
Yeah, I would say a little bit faster, and it's going to be more stable. Bones want stability when they're healing. If you don't have that internal stability provided by the intramedullary screw, then there's some micro motion, and that can lead to a delay in healing or a non-union, kind of what we're worrying about when a high-level athlete gets this type of injury.
Tell me, does that screw stay in? Is this person in a boot for 6-8 weeks? Is there any mobilization, or because the hardware is in there, intermedullary screw, can you progress a little bit faster?
When the screw is placed, if it's placed in a good position, you can what's called countersink it so that it's not prominent and bury it into the bone. That way that you can keep this forever without hopefully having issues with hardware prominence. Now, with the stabilization that this provides, the kind of healing time you're looking at is, on average, people can return to sports at about the 7.5 week. Now, that doesn't mean that they're ready to go and play, at the professional level, but that means they can start getting back to practice, starting their therapy regimen, and getting back to it. You really want someone to not be tender or to be asymptomatic, and really progressing well and no difficulty with their walk before you really get them going.
Yeah, once you're able to weight bear, you're going to start taking them through all this triplanar, proprioceptive, all this facilitated activity to simulate return to sports and make sure they're healthy. But the nice thing about it, these Jones fractures, once they're stabilized, proper healing, these people are going to return in time to functional activity and be pain-free and experience a good return to function.
Yeah, that is correct. And, the good thing about this surgery is sometimes it can be done through an even small incision, 2 to 5 millimeters long.
Yeah.
So fairly minimally invasive.
That's that new word out there that we're hearing and talking to a lot of surgeons about: minimally invasive surgeries, better recovery, faster rehab, less soft tissue irritation. Let's have you back on in the future. We'll talk some sports medicine, okay?
Looking forward to it. Thanks again.
Absolutely.
That's been Dr. Christopher Thomas, orthopedic surgeon at Skagit Regional Health in Mount Vernon and Arlington. Jones fracture injuries and recoveries, and good advice from him on how to recover from that, and good insight into what that injury entails, Shannon.
Yeah, it's an interesting injury. It takes time to heal because of where the fracture is, but return to sports is possible, i.e. Derrick Henry again.